Welcome to this edition of Clinical Clips, an accredited continuing education activity. This brief expert video will spotlight the daily hot topics from the conference.
Hello, my name is Michael Wang. I'm the Putin Clark Endowed Professor in the Lymphoma Myeloma Department at MD Anderson Cancer Center. It is my great pleasure to share with you some insights on the CAR T-cell therapy from the most recent American Society of Hematology annual meeting that happened just last week. This is recorded as the part of the clinical clip series. The first abstract I would like to discuss is the primary analysis of the ZUMA-7 clinical trial. The ZUMA-7 clinical trial is a phase 3 randomized multicenter clinical trial comparing the standard of care therapy for relapsed large cell lymphoma with the axi-cell CAR T-cell therapy, which is a CD19 directed CAR T-cell therapy. In this clinical trial, 359 patients was enrolled. The follow-up time is very adequate at 25 months. The event failure survival was 83 months for the CAR T-cell therapy, which is much longer than the 2 months with the standard care therapy. The other parameters, such as ORR response rate, CR response rate, was also very significantly high in the CAR T-cell arm than the standard care therapy arm. And the overall survival curve trend favors the CAR T-cell therapy arm. The toxicities of CRS, neurotoxicity infections are also very manageable and comparable between the two arms. The authors think this is a new standard therapy for first relapse of large cell lymphoma patients, and I totally agree. I really think this is a major advance in relapsed large cell lymphoma and the standard care therapy. The second abstract is the Transform study, which utilized Lysocell, the CD19 CAR T-cell therapy, compared with the standard care chemotherapy. This clinical trial enrolled 184 patients. The event-free survival was 10 months long with the CAR T-cell therapy, much longer than the 2.3 months with the standard care therapy. The failure-free survival, CR, also are very statistically significant in favor of the Lysocell CAR T-cell therapy arm. The authors also think this is a promising new standard therapy for relapsed large cell lymphoma, and I also agree with them. Although the ZUMA-7 and Transform study utilizes the 2 CD19 CAR T-cell therapies from 2 different companies, but they are both superior than the standard care therapy. I think this is the 2 abstracts confirm each other's results. The next study I like to discuss is the primary analysis of the ZUMA-12 clinical trial. This is a phase 2 study of axi-cell as a first-line therapy in patients with a high-risk large cell lymphoma. The high risk including double-hit large cell lymphoma, triple-hit large cell lymphoma, and IPI equal to 3 or greater diffuse large B-cell lymphoma. The whole trial enrolled 42 patients. The median follow-up was 15.9 months. The ORR was very high with 90%, the CR was at 80%. The CRS and the neurotoxicity infections are manageable. This is indeed good data shedding light on how we approach with the highest risk large cell lymphoma. The next abstract is the long-term overall survival in the ZUMA-1 clinical trial. ZUMA-1 clinical trial is using axi-cell, was the first ever study published on large cell lymphoma, and this abstract is on the longer follow-up on this clinical trial data. The median follow-up time was 4 years. This clinical trial included 111 patients. The median overall survival was 25.8 months. The 24 months event-free survival was 38 months. This trial is very important, and it tells us that even with a longer period of time, a significant number of patients remain lymphoma-free, and their overall survival is quite long. We have just talked about the large cell lymphoma. How about the indolent lymphoma, such as the follicular lymphoma and the marginal zone lymphoma? The ZUMA-5 study also uses axi-cell to treat the follicular lymphoma and the marginal zone lymphoma, and both of which are indolent lymphomas. In this clinical trial with the ZUMA-5, 149 patients was enrolled. 80% of them were follicular lymphoma, and 20% of them are marginal zone lymphoma. Follow-up time was 31 months for follicular lymphoma patients. The overall response rate was 94%. The CR was 79%. The duration of response was 39, and the failure-free survival was 40 months. For marginal zone lymphoma, the median follow-up time was 24 months. The overall response rate was 83%. The CR was 63%, and failure-free survival 17.3 months, very durable. So axi-cell is also very effective in follicular lymphoma and indolent lymphoma. We have just spoke about large cell lymphoma and follicular lymphoma. There are 3 abstracts for mantle cell lymphoma that is also important. And one of them is regarding a CAR T-cell therapy in the real world with the breakthrough cell. Breakthrough cell was first reported by myself with the ZUMA-2 study with the overall response rate of 93% and the CR of 67%. In this real-world data reported by Dr. Yisai Wang, Mayo Clinic, Rochester, he reported that 107 patients enrolled in this retrospective clinical study. 95 of them received the CAR T-cell therapy. The overall response rate is 89% and CR of 81%. Very comparable with the overall response rate and CRs reported in the ZUMA-2. The median follow-up is too short, 6.7 months. Therefore, the median duration response, failure-free survival, overall survival have not been reached. I have just finished talking about the CAR T-cell therapy in lymphoma. I would like to switch gear to multiple myeloma. The first abstract on multiple myeloma is the BB21217 clinical trial. This clinical trial utilized ide-cel, a BCMA-directed CAR T-cell therapy in multiple myeloma. In this clinical trial, the median follow-up time was 9 months. The patient population has received 6 median prior lines of therapy. The overall response rate was 69%, CR was 36%, even in the phase 1 clinical trial. The duration of response was 23.8 months. The CRS neurotoxicity was manageable. The best clinical trial with CAR T-cell therapy on myeloma, in my opinion, is the CARTITUDE clinical trial. The next abstract I would like to discuss. This is a phase 1/2 clinical trial, multi-center, uses a BCMA-directed CAR T-cell therapy on multiple myeloma. In this clinical trial, 97 patients was enrolled. The overall response rate was unprecedented at 98% response, and the CR very high at 83%. The median follow-up is long as 2 years. The most striking data from this abstract with the cell-to-cell CAR T-cell therapy is that the PFS, failure-free survival, and overall survival favors the CAR T-cell therapy arm with the cell-to-cell. I really think this CAR T-cell therapy is a really potential promising therapy for relapsed multiple myeloma therapy. Thank you for joining me for this ASH clinical clip on CAR T-cell therapy. Be sure to view our other 2 clips from ASH 2021 on low-risk MDS and relapsed multiple myeloma. Thank you.
We hope you found this activity useful and educational. To receive continuing education credit and to download your printable certificate, please return to the activity webpage and click on the Claim Credit button associated with today's clinical clip.